Normally, when we eat food and food gets entry into the stomach, the vagus nerve causes the muscles of the stomach to relax. It helps increase the stomach's volume and accommodate the food that is getting entry into the stomach. Apart from this, the pyloric sphincter allows the food passage into the duodenum in small proportions, and for this reason it opens intermittently. When food gets entry into the duodenum, the digestive juices like bile, pancreatic juice, etc. are released into the duodenum and it digests the food further. In vagotomy, which involves the transaction of the vagus nerve can no longer relax the stomach, and so when we eat food, the stomach fills up much earlier than it normally does because of the increased gastric tone. This causes the food to be passed into the duodenum earlier and quicker. Procedures like gastrectomy and drainage procedures, including pyloroplasty and gastrojejunostomy, causes the food to bypass the pyloric sphincter, and so these procedures also cause the food to be entered into the duodenum much earlier. In other words, we say this that the stomach dumps its food into the duodenum earlier than it should not. As the stomach now dumps all the food all at once into the duodenum, the bile, pancreatic juice, and intestinal juices rush into the lumen of the intestine to digest this food. Since there is a lot of food, all this makes hypertonic solution within the lumen of the intestine. This attracts water from the vessels that line the intestines, causing fluid shift from the vessels, leading to hypovolemia within the body. This does three things. It activates the sympathetic system, it causes the person to become dizzy and he might faint, and it also leads to osmotic diarrhea. Sympathetic system causes the heartbeat to become fast, flushing, sweating. All of this is known as early dumping, and this occurs within 5 to 45 minutes. As the process goes on further and the food that is dumped into the duodenum and intestines is being digested and broken down into glucose, all of this glucose is absorbed all at once into the blood. That increases plasma glucose level. This causes pancreas to increase a lot of insulin, leading to hypoglycemia at once. This also activates the sympathetic system and causes the same features along with tiredness, exhaustion, or prostration. As the digestion takes some time, therefore, it results in late dumping syndrome, which occurs within 24 hours of ingestion of food. In order to avoid hypoglycemia, we give the patient octreotide, which is a somatostatin analog, and it helps antagonize the functions of insulin. Along with it, dietary changes are taken up by the patient. He should take small and frequent meals. The meal should be low in carbs since refined sugars absorb a lot of water, and the patient should also avoid fluid while he takes his meal. The meals should themselves also be dry. These changes help the patient overcome the symptoms.